Well, hello everyone. Glad you could join us tonight. We have some really great information, I believe, using PBM for oral mucositis. We'll be talking about that, and I'll get into a little deeper as well separately. And so we will be starting that shortly. And for those that are watching, they will be entering into a ballot every time they watch. So at the end of the month, we will be giving away one of our Palm Ultimates, which has the 660 nanometer and the 810 nanometer. And it's a beautiful device, value of $1,300. And that will be drawn. So if you watch us 3 times out of the month, you'll get 3 ballots entered in. And we'll do the draw at the end of the month. So anyways, welcome everybody, and we're going to go into our first little video clip, and then we'll get things really rolling.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's a sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have 2 different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can.
So our first little section now, we're going to talk about how PBM can be used for nausea. Very interesting, so go ahead.
You can use it to prevent nausea and gagging. So if somebody has got nausea and gagging, and it actually helps with hangovers too. It's called P6 in the wrist. So if you use that big unit and put it over your wrist, on both wrists, you can reduce gagging and nausea.
So that was Dr. Gerry Ross, and although he was very short in that particular message, he has a wealth of knowledge on PBM. He's a dentist that has traveled the world and presented how light PBM can be used for all different applications. Anything from TMJ to TMD to working inside the mouth for tooth extraction, for you name it, but has been able to present that for, I forget now, it's like 30 years or so that he's had it in his practice. Very knowledgeable. If you ever want to learn more, let's say in a course, they have the GMA has a laser course, laser, but LED as well, course on how photobiomodulation, how to use it within your practice. So now what we're going to do is go to the next section, and that's going to be on oral mucositis. And oral mucositis is a condition that occurs when people undergo cancer treatment, but chemotherapy treatment, and they will end up getting lesions inside their mouth. So bad that they may have to cancel the ongoing chemotherapy treatment, and so people can't eat anymore. They have the feeding tube. It's really, really ugly. But if they use light therapy inside the mouth, it shows there's research out there that shows you can totally eliminate those problems. So that really is something that happens as well with, obviously you can have other lesions in your mouth, but same principle applies where PBM can be used to speed up that healing inside the mouth. And if you have cold sores on your lips and that kind of thing. So now what we'll do is we'll go into that next video.
Question came up about cancers. I can't speak to that. There are some studies out there. One of the concerns that some have had is, okay, if this light can help regenerate cells and help cells to proliferate, what about with cancer? Could you use the light and it actually causes the cancer cells to grow? And as a matter of fact, what happens is there's some studies out there that are showing that no, that's not the case. That the light actually, what it does is it creates a negative environment. That's the best way I can describe it. A negative environment where the cancer does not have ability to thrive. So it's possible that this could be light therapy could be an adjunct to other forms of cancer treatment. Oh, one that's very good on cancer treatment, thank you for asking, is with oral mucositis. People will, during chemotherapy treatment, will end up getting a lot of sores in their mouth. Some of them are so bad that they actually have to stop the chemotherapy treatment. The person can't swallow, they end up on a feeding tube. It's just absolutely ugly. Turns out that light therapy that's been studied out there, that light therapy can actually totally reduce or eliminate the oral mucositis inside the mouth. And we actually have the power in our device to go right through. I got some pictures where it shows that it can go right through the wall of my cheek into the area, so it has no problem bringing light into the oral mucositis area and help to heal that. So that the person that's getting chemotherapy treatment could continue to get that treatment while they use the light therapy to prevent the oral mucositis from forming. Also, neuropathy, which is something that will come in a future episode. there's great gains from using light.
Is mucositis. People that are having chemotherapy, a lot of the times they'll get what's called mucositis. If they're having radiation therapy in the mouth, 100% of those patients will have mucositis. And these are just a couple of pictures of mucositis. There's one. You can imagine what this is like. And this is not just the outside of the mouth, it goes all the way back into the throat. So this is the leading reason why people stop the chemotherapy treatment or the radiation treatment. Well, PBM can prevent or minimize the effects of it. And it is just a huge, huge thing. So there's a friend of mine, his wife just went through stage 4 pancreatic cancer treatment.
To take out the laser, showed her how to use it, and she could not believe how fast her pain went away and how quickly the area healed. My wife Sue has advanced pancreatic cancer, and her chemotherapy was 100% FOLFIRINOX, which is the strongest chemo you can receive. She also received the maximum dose of radiation that they give. Now, Gerry started to mention oral mucositis, and this is one of the most debilitating side effects of chemotherapy. But because she used the laser every day, she got not one single sore. Now, this also helps with many of the other side effects of chemotherapy: nauseousness, cold tingling fingers, neuropathy, TMJ pain, that's your joint up here. This has helped her with all of these, and she did not receive one single skin burn from all of this radiation. Chemotherapy and radiation also give you fatigue, and I taught her a protocol to use for this. But not only did I teach her to use it, I do that on myself every single day. I work out every single day, usually for about an hour and a half to 2 hours, and I use the laser for preconditioning before I go to treat.
And I guess one other area too that is wounds is the whole area of the mouth with oral mucositis. Can you take a moment and just mention about that, how it helps the mouth to heal?
Right, so that is where we have actually the strongest evidence, because the evidence there has led to a recommendation of a clinical practice guidelines that will help all cancer patients. So when we are treating a patient with cancer with chemo or radiation or stem cell transplants, unfortunately, they're also damaging the normal tissues that are being exposed to these agents. And one of the common clinical presentations of these patients is mucositis in the mouth, as Tom, you pointed out. If you do photobiomodulation treatments 30 minutes to 2 hours before the patient gets chemo or radiation, it has been shown in 35 placebo-controlled randomized human clinical studies that there is significant evidence of preventing or reducing the severity of oral mucositis. Yeah, this is now at the level of clinical practice guidelines. So we basically recommend that every patient actually get this treatment to get the maximal benefits.
And that's right now the standard of care in California. They're suggesting that. Is that?
I don't know about California, but I would say that the 3 organizations that did the initial assessment was the Multinational Association of Supportive Care in Cancer, MASC, the International Society of Oral Oncology, and the World Association of Photobiomodulation Treatment, WOT.
Wow. You have brought together a lot of information, and you only got a chance to give us that little tiny amount of information just on burns and wounds, but so many different areas of the body can be helped with this light technology.
A question comes in about oral mucositis. Can you tell me how light can make a difference on oral mucositis?
Right. So let's jump into the photobiomodulation section, because I think it'll address both the questions that were just asked. So photobiomodulation is the use of low-dose light to either inhibit certain negative processes such as pain or inflammation, or stimulate certain processes such as tissue healing or regeneration. So this technique is a non-thermal use of low-dose light. And this treatment, unfortunately, doesn't get its due. So every time we talk about light, we are always usually made fun of. We're like, people are not plants. How can you use light to do any kind of treatment, right? That's the usual refrain that we get from our audience. Now, you will not be surprised to hear that light is a form of energy that the human body not only uses regularly, but is very required for its normal function. So when we think about light in human health, most of us think about sunlight and the very specific biochemical process involved in the conversion of vitamin D, which maintains our teeth, our bone, and our psychological health. So all of us know the benefits of sunlight. Your very ability to see these slides, right, vision, is enabled by a very specific protein in your eye, rhodopsin, that is capable of receiving visible light and converting it into a signal that is perceived as vision. We also know that light is extremely important for your circadian rhythm and your psychological state, right? We know that dark places are not great for your mood, and there are very specific mood lighting now available to enhance your psychological health. So all of these are great examples of how now you're using the physical energy of light to maintain a state of health. So can we use this therapeutically? You will be amazed to hear that there are over 360 different terms for the use of this treatment called low-level light treatment of photobiomodulation. So in 2014, a group of experts got together in Arlington, Virginia at the combined Knowles meeting, and you can see several of the luminaries in the field of photobiomodulation here. And we agreed on the term photobiomodulation, which is now a subject head term, a mesh term, that is used by the National Library of Medicine to archive all the literature that refers to this treatment. They define photobiomodulation as the use of non-ionizing source of photonic energy that generates non-thermal therapeutic benefits. In the field of photobiomodulation, we use a larger definition, and this goes back to Tom's point about LEDs and lasers. We know photobiomodulation can be done with different forms or different sources of light, and we include the definition of the light sources, which includes lasers, LEDs, and broadband light within the visible to infrared spectrum that are used in a non-thermal manner. And we like the term photobiomodulation because if you use the right protocol and the right dose, you can promote certain positive processes such as wound healing and tissue regeneration. At the same time, if you can use a different protocol and a different delivery technique, you can inhibit certain negative processes such as pain and inflammation. And we prefer to use the term photobiomodulation therapy, PBM therapy, and not PBMT, that is often also used. This is a rather busy slide, and I don't expect you to read any of those details. And I should have mentioned this up front, but I'll give you my email at the end, and I'm happy to send you my entire slide deck if you're interested in looking at the references and the details of the slides. So this is our current understanding of how photobiomodulation works. Everybody is probably familiar with the term cytochrome C oxidase and mitochondria, right? There is a very specific enzyme inside the mitochondria called cytochrome C oxidase, which is capable of absorbing visible and infrared light and increasing transiently ATP and ROS inside the cell. Now, this particular process has been well studied. This was first described by Dr. Tina Carew and Dr. Harry Whelan, who described this process and have published papers on that. There is another mechanism which involves membrane receptors and transporters, and the one that we always draw attention to is TRPV1, which is a pain receptor on neurons. So absorption of light by this specific receptor is capable of disrupting neuronal pain conduction. And this is one of the mechanisms of how light is capable of analgesia or pain relief. The third mechanism involves activation of an extracellular growth factor called TGF-beta1. And this is work from my lab that has shown that this factor, when activated, is capable of driving the tissue healing and regenerative responses that PBM has been shown to do with endogenous stem cells. So we can promote the regular tissue healing and regeneration using this technique. Now, we know that when you're doing light treatments, you're probably activating multiple pathways And therefore, in diseases, you can get both pain relief as well as improved healing and reduce inflammation because of activation of multiple pathways during photobiomodulation. And that is the impressive list of clinical applications of photobiomodulation. As you know, there is significant evidence for the use of PBM in age-related macular degeneration, as well as Parkinson's and Alzheimer's, as well as all of these several clinical ailments that have been listed here. And if you're a dentist in the audience, pretty much every field of dentistry, especially mucositis, which will be the rest of my talk, has been shown to be very important and has shown great clinical efficacy and safety in these treatments. So the big news, as I mentioned in the beginning of my talk, is the upgrade or recommendation of photobiomodulation for oral mucositis. And many of you are familiar either or with this condition where you actually have inflammation, pain, and breakdown of the oral mucosal lining. And that's what this is just a scale, the WHO scale, showing that photobiomodulation can present as redness, inflammation, or frank ulcers, as you can see in this. So these are the publications over the last few years that have recommended the use of photobiomodulation in prevention and treatment of oral mucositis associated with cancer care, right? Different forms of cancer care, such as chemotherapy, radiation therapy, as well as stem cell transplants, and most recently, some immunotherapy, cancer immunotherapy protocols have also been shown to be mitigated. The mucositis has been shown to be mitigated by the use of photobiomodulation. So these are the current references and the recommendations from the Multinational Association of Supportive Care in Cancer and the International Society for Oral Oncology, as well as the World Association of Photobiomodulation. So these are evidences from 35 well-done, placebo-controlled, multi-center human clinical trials that have outlined this evidence. However, as biomedical scientists, we like to, explore things in the lab. So I'll show you two pieces of basic research data. Hopefully, that is not too distracting. But here's an example.
This is excellent, Praveen. Keep going. You're talking to people that want to learn about this whole thing. So keep going.
Excellent. So here are two examples of research studies we do in the lab. So we collect epithelial cells, which are the lining cells of your oral cavity. And when you put them on a plastic culture dish, they will grow into a confluent culture. They'll just grow and completely fill this culture. So to simulate a mucositis or a wound, we use a plastic tip and make a scratch. And this is the example of a wound that has been created in the culture dish. When you do photobiomodulation, when you just wait for normal healing of the cells, you can see that this wound will close over time. But when you do photobiomodulation, you can significantly accelerate this healing response. Now, this healing response is partly attributed to the cells that are migrating into this wound. But the other thing that happens in the wound edges is that you have these epithelial stem cells, also called epithelial colony-forming units, which are significantly increased after photobiomodulation treatment. So these two papers outline the evidence for improved oral and skin wound healing following photobiomodulation. In the lab, we also used several different types of wound injuries. And this is a paper that came out recently that showed that burn wounds, as shown in this image here, which normally heals with scarring and inflammation, can significantly be reduced and you get a better healing response when you perform photobiomodulation. So this is hopefully, you can see that there is human clinical evidence, but there is also mechanistic evidence at the cell, at the tissue, and controlled animal studies. So we have very good evidence that this treatment will work and will be efficacious in your patients. When we talk about oral mucositis, we are usually talking about cancer care. And one of the major concerns in patients is that if you have a cancer tumor in the field, would you be potentially stimulating that, right? And the answer to that at the moment is an unequivocal, a clear information is that there is no stimulation of the tumor. And these are the references for that work. So the first two are clinical studies in human patients. and the third one is an animal model. Just to summarize that area, there is a lot of good research in this area, but just to summarize that response, when you take a normal cell and a tumor cell is very similar to a normal cell, but is dysregulated. It's a rogue cell, right? It's going out of control. So when it receives photobiomodulation energy, it tends to commit suicide. It undergoes a process called apoptosis and autophagy when you do photobiomodulation. At the same time, the host immune response against these tumors is enhanced, and therefore you see less tumor burden. Again, if you're interested, we have been publishing several papers in this space. And again, this is molecular work, which I will not go into much detail, but we have been able to dissect why light can be stimulating in good normal cells, while at the same time, it can potentially promote autophagy or apoptosis. And this is the pathway that you can see in tumor cells. So the good news is we understand a lot about the molecular mechanisms. We have very good human clinical evidences for their efficacy. But then why do you hear all this negative data, or sometimes you hear that this treatment doesn't work great? The reason for that is this treatment is extremely easy to do, right? It's a very simple, buy the device, change certain settings, and then treat your patients. And if you, we put an editorial here, which basically talks about how easy it is to do. The complexity of the responses, unfortunately, and there are several protocols. So if you're interested in mucositis specifically, there are several protocols that have been published. The complexity of the light treatment comes in the manner and the device that you're using to do the treatment. There are several devices that are out there with different wavelengths and different treatments. But if you do purchase a separate or a specific device, you need to understand that what you're doing with that energy, and don't worry about the written stuff, you need to understand how to use that in an effective manner. And that is where webinars like these, but also several device-specific training are very important for you to effectively transfer what information we have into an effective clinical protocol. So again, those who are interested, there are several new concepts on how to use this effectively. And I'll specifically point out to this concept on your left, which talks about photonic fluence or photonic energy transfer, which allows us to convert many of the literature that is published with red and infrared, 660 and 810, into other wavelengths, blue, 1070, 1064, and other wavelengths. So if you follow this protocol, this dose calculation, you can effectively use it.
Mucositis, I'm assuming it's oral sores with chemo.
Yes. Yeah, there is. This is a huge topic. In fact, this is one of the major topics in our course. It is extremely effective in treating mucositis for radiation for both adults and children with stem cells and after chemotherapy. In fact, one of the people I lecture with, Mel Burchman, his wife has stage 4 pancreatic cancer, and actually she's doing extremely well. She's almost 2 years out and her cancer numbers are dropping. But when they first found the cancer, she had an extremely heavy chemotherapeutic agent. And Mel basically preventatively shone at the cheeks and into the mouth, and she never got any of the mucositis. And after she finished the round of chemotherapy, the oncologist shared with Mel, they've been using this as a major treatment of pancreatic cancer. She is the first person ever to go through that treatment and not get mucositis. So I don't know if people know mucositis. Think of hundreds of cold sores in your mouth at the same time. It's usually the leading reason why chemotherapy is stopped. And PBM is shown effective. And second of all, the Society of Oncologists have recommended that as a treatment. So it is safe using around the cancer. If somebody has got sores in his mouth due to chemo, so I want to make sure we get a chance to address this one. So basically, this is, if you have the palm, what you want to do is treat, first of all, what I would do is try to get this one as well. You want to treat the lymph nodes underneath here on both sides. Then you want to treat on your cheeks. Now, what you're doing is you're trying to get into the mouth. So I would probably, in trying to heal, I would probably do about 16 joules on each cheek, both like this. Now, depending how much mucositis you've got in your mouth, is you may be able to go in the mouth and treat the sores individually in the mouth, If not, basically open your mouth and shine it that way. Now for this one, it has been shown with mucositis, the ideal wavelength for this is red. So you want to be using the red wavelength. Tom said you have a choice of red or infrared. So do that. And so, as I say, if this isn't helping you, you need more help, you can get hold of me through Kirsten and I will try to help you individually. So don't feel free to contact me.
All right, so there you have it from 3 different doctors, Dr. Mel Burchman, Dr. Gerry Ross, and Dr. Praveen Arany. Dr. Praveen Arany is a professor in University of Buffalo, and the other 2 are both dentists that have been in this field with the PBM for a very long time. So when you're talking about healing in the mouth, this also applies for healing other parts of the body as well, as far as speeding up that healing. So as I will now just go over to the other video.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cells super high octane fuel, and they run like a jet and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So at this point in time, I'm going to go into a little bit of explanation on our products. And so here we go. So we have 2 different versions of or 3 different versions of the Palm. 2 of them are with the 660 and 810. So the 660 is the very bright wavelength that you see here. And if I can turn off this light here, you can see the light going right through my hand. Now, in this case, this has the 810 nanometer. It just doesn't look very bright, and it doesn't show it, but if you could see it as this 1 meter can see it, you could see how much more is actually going through this wavelength than the other one. So the 660 is very much involved in stimulating the blood, and the 810 can, even though the 660 doesn't penetrate as deep, the 810 can go much, much further. So we have 2 products of that type, which is 660, 810. We have the Professional and the Ultimate, and the Ultimate has more power behind it, so it's like 25% more power. And then our most recent unit is the unit that we have, which is 660 nanometer, same power level as the Ultimate, but it has the 1050 nanometer. Now, you'll see this one red light on here. That's just an indicator, but you can see the little purplish dots that are there, and that's the 1050. So I don't know, I've not tried this on a screen yet, but I'll show you something that we hope you can see. Yeah, actually that's coming through okay, I think. So right now you're getting a very low level right down here is 1.7. Put my glasses on, make it a little easier. So when I put the other light in front of it, and I'll do the 660 nanometer light, it's right now shining right through my hand, and I got 44, measurement of 44, 49 as you can see. And if I switch to the other wavelength, it's actually, so it's 135 times 10. So it's 1,350 with the totally invisible near infrared, whereas the red is only a reading of 31 times, times 10 is 300. So it's got a reading there of 300, and that's got a reading of 900, to give you an idea, just to show you. 900 and 250. So you can see that the penetration depth is much, much higher with the near infrared. Now, some others out there would also say, well, why would you, if I can buy some low-cost devices, and they got lots of LEDs on there too, like some units like this, but it comes down to power density. How much power do you have in close proximity? So if I was to take this unit, I would need to scrunch it down to about this size, and that's all we would get, and that might be closer to the power level of this device. Whereas this device has the power very, very continuously over the whole area. Oh, you can see some writing on there, but so there you can see nice and even illumination of light. So the power is very even over that whole area, the round area of 40 square centimeters. When we're talking some of the other devices, like this one, the light only comes at you in spots. So it's kind of like little dimpled areas of light. Now, sure, if you put the light meter right in front of one of those dimples, it might read almost as high as my light. But the problem is, it might read just as much here. But the problem is all this area all the way around has nothing pretty much. So, and they may mix the wavelengths, but what we do is we have 100% of the power on the one wavelength and 100% of the power on the other wavelength. And that is really critical to being able to get light to go through your shoulder, into the joint, into the hip, to reach the hip joint. So, so that's the differences of light. And I just presented in England, where we also did measurement of how much light goes through steak, pork, and chicken. So we had 3/4 of an inch, inch and a half, and 2 1/4 inches of steak or chicken or pork. And the thing about it was that we measured how much light, when it's, let's say, a 5-watt laser, how much of that light gets through that tissue compared to our, let's say, 5-watt light. 5-watt, we actually have more than that, a little more than that, but how is the comparison between an LED source that's 5 watts and a laser source? And what we were able to do is show that at, let's say, 1064 nanometer laser and 1050, our device, 1050 nanometer, our device, that after you went through all that tissue, didn't matter whether it was 3/4 inch, 1.5 inches, or 2 1/4 inches, by the time you went through that tissue, the light that came through a 2-inch opening of the steak on the other side, or chicken or pork, was the same level. So the difference being is one of these laser devices and the LED, our device, our laser device, costs between $20,000 and $30,000 in the medical realm, and our device costs $1,900 in the medical realm. So you're getting the same amount of penetration through all that tissue. We also did the same thing at 810 nanometer and 660 nanometer to compare laser versus LED. And in the end, it really depended on how much power you had at the surface going into the tissue, as opposed to, so the two were equal between the laser and LED. So now what I'm going to do is, that's our two devices there. We also have our helmet device, and the helmet has the 2 wavelengths of light on it. It has the 660 nanometer, and it also has the 810. You can kind of see the 810 in there a little bit. There you go. You can see the purplish dots. So this just goes down on top of the head, and we've been able to see this have a benefit for dementia. And there's a new study that'll be coming out for us with for Parkinson's that we're hopeful that's going to happen soon. So we're excited about that. We've got another study going on. We talked about oral mucositis. We got another study going on in California that's just about ready to start. We just had the study for using the helmet in West Virginia, which showed that people that they had a group of 25 that had the light treatment, the other 25 did not. So we're talking of these are all people with oral mucositis. All of these people had opiate addiction and depression, and they found out that just getting 2 3-minute treatments with the 810 with this device, the helmet, that after 2 months, those that were in the treatment group with the light ended up getting being much better. Their outlook of life was better. Their cravings were less. It was just a whole series of things. You can find that on our PBM 2024. If you go on the research page and go all the way down to the bottom, we have that new study posted there. So yeah, we've been having some really neat things starting to happen. We also got, as far as more research out there, although there's lots of research, if you look on that research page, you'll see the link for the database. And there's a database there of like over 7,500 research articles. Need to go there and you could type in, let's say you want to look up, well, has anything ever been done with asthma? Well, you could type in asthma and look at the studies that would be there for asthma. So there's a lot of different studies there. This is what we call our mini canopy. This is a device that has 15 times the area of the palm with the same power density that we have as the small to larger to the much larger canopy device. So now I'll start answering some questions. I'll try and answer some of them. Okay, how do you use or apply the PBM when you have this reaction to radiation, oral mucositis? So the protocol, there is a guide that we have on our website as well. And as far as to actually use this unit, I would suggest that a person would do some very short treatments on the external of both wavelengths. Ideally, probably because you got to try and go through the cheek and get to the gum line. Probably 2 minutes of the red and 2 minutes of the near infrared. So you could do 2 minutes there, 2 minutes there, 2 minutes there, and 2 minutes there of the red, and repeat that with the near infrared. Also, we do have an oral probe that can go into this device, and then the light comes out of the tip. And so you can actually treat inside the mouth, various places, the tongue a little easier. And as Gerry Ross had suggested, a person could open their mouth as wide as they can and allow the light to come in that way as well. Why are they discussing laser instead of LEDs? And that's a question from Jamel. Thank you, Jamel, for your question. The reason they have it even ingrained, they have used the term laser for 30 years. And you know what? When they pick up my device, they call it laser, even though it's not a laser, because they're so used to calling everything that they use a laser. So no, they are using, you can easily use LEDs for everywhere. Only place, I mean, really, there's places for laser when you have to have a, where you have to have a cavity taken out, you need a high power laser. And that's an extremely focused light device. And I don't think you probably have $200,000 to spend, but anyways, the light can do, for dentistry as a laser, can do all sorts of things inside the mouth. So can we in certain applications using the oral probe just to put that in there and then using it that way, light on the area. Okay, okay, I will, a question came up, is it possible for me to send out one of these light meters so that they can show the patients how the light goes through? It's a great demonstration, my first time, so thank you for putting up with a bit of inconsistency in the first time. Okay, Elizabeth is asking, what about using the super pump for shoulder pain? So shoulder pain, you want to spend about, I would say, about 20 minutes to 30 minutes over the shoulder. If you have an area that's really painful, you want to be treating that a little bit more in that area. But generally, when you're doing that treatment of 20 to 30 minutes on that area, you're going to use about 3/4 of the time you want to spend with the near infrared, because the near infrared will penetrate much deeper. You still want to use the red though. You still want to use that bright red, even if it doesn't penetrate all the way to the shoulder joint. And the reason being is because the red will be absorbed by the blood, and the blood will carry it much further than that. James is saying hi from California. Yeah, I was just in San Diego, California 2 nights ago. Few nights, Saturday night. Yeah, Saturday night. And so it was a great trip. Was able to meet with a bunch of naturopaths out in Arizona and as well in California. So, okay. Okay, Janet, that's a very good question from Janet. I have had my 1050 for 2 years now. How can I find out how much life is still available in it? Well, as a matter of fact, the LEDs that we're using and the way we're using it, I do have a patent on the cooling mechanism that I have in here. And the thing is that the LEDs are run very cool. When I say cool, they're designed to run at 85 degrees C and still live, but their life is a little bit shorter, but they still say that it's possible to get up to 50,000 hours. Now, I actually run these LEDs about 40 degrees Celsius cooler, so at 45 degrees C. So these LEDs are running really cool. So the length of time that would be left is basically, take off 2 years of use and you got another 23 to go kind of thing. the light levels are going to stay high, unlike the old fluorescent bulbs, which started going dimmer and dimmer. This light with the LEDs and the way we've designed it keeps us keeps the temperature of LEDs in a very good spot where they're very happy. I call them happy LEDs. So they'll last for a very long time. Okay, so could this device make a bone grow back? Dina is asking about that. And Dina, they're showing that this actually does cause bone growth. There's research out there that shows why it can. And I had somebody on a very long time ago on my webinar. He had actually been riding his bicycle. He's a bike rider, every day, does, 10, 20 kilometers kind of thing. And he fell over his handlebars and wiped out and broke several of his ribs on the way over the handlebars, and some other injuries as well. Now, he happened to have this light, this canopy. He had purchased one for his pet, and his pet ended up improving quite a bit. But he had the light, and then this happened to him, and they did the X-ray of his ribs, and it showed distinct broken ribs in the X-ray. And they said it's going to be, a lot of just laying around, taking it really easy. Forget about bike riding because you got that stress that you're putting forward. That'd be extremely painful. Well, he immediately used the light, and the next day he was able to ride his bike again. And after 1 month, he decided he wanted to get a comparison to see what was going on with his bone health. And so he had another set of X-rays done, and the X-ray technician looked, and he said the bone growth was so good, and he compared the X-rays. He said the bone growth was so good, the way it went together, that there was no evidence that he actually broke his ribs, and that was within 1 month. So the possibility of helping bones to grow is there. Now, I can't tell you about teeth. I don't know how long it takes to to remineralize and fix that, but we've had some people with different types of issues, including one person that had part of their jaw was in real trouble, and they have been able to regrow the bone in the jaw area. So it's possible to help that. Okay, we've got, all right. Will this help receding gums regenerate? I believe it probably could, but you would have to, and if it would, it's something that's going to take time. Some of these things to regrow tissue into areas. But I can tell you, when a person damages themselves, like in accidents, that the reparative sequences that are going on can really speed up. So I do know that one of the girls, she was swinging around in a tree with her friends, and with a rope, and she ended up jumping out of the tree, but didn't get rid of the rope fast enough, and the rope managed to lasso her longest finger and take the whole top of the finger off. And with that, they had to shorten the bone and put it back together, put the skin back around. And they said that it would require probably multiple surgeries to get rid of the scar tissue that would form in the process of healing. And that in 2 weeks, they'd have to determine what other what other surgeries would be necessary. And this girl was using the light every day, and when she went in to see the surgeon, the surgeon said, your finger is totally healed the way I'd want to have it. And so there was no possible, no further requirement for further surgeries. So just with the healing process was done so nicely that there was no scar tissue. A lot of times with people with surgeries where they have to do incisions and cut through the skin, the healing of those to prevent scarring is huge. So light is very, very beneficial. PBM is very, very beneficial to doing the healing process. I've got another slide deck that's on one of the other videos. By the way, we have videos, longer videos with different doctors that you saw tonight. And if you just scroll down the past videos, you can watch the videos there that we've done on different cases. But we do get into bone healing, different types of healing. Haven't gotten into bone, but yeah, it's very possible to help that. And what I would say is that for trying to do any type of treatments, first of all, I'm not a medical doctor. If you need any medical advice, please seek your doctor. First question you might want to ask is, has he ever heard anything about PBM? Maybe the second question is, does he use it at all? Because 99.9% of the doctors do not know anything about PBM, and they should, because it could really help their patients. So, okay. Would this be, Nalini is asking, would this be beneficial for moderate degenerative changes seen on the right TMJ? Yeah, anytime you can help with the light, it will help slow down that degenerative process, because it really helps with a whole pile of different mechanisms. And I thank you, Catherine, is saying I will help with bisphosphonates. I'm sorry, Catherine, I'm going to have to get back to you on that. I don't know. Please email your question in and we'll try and dig into it. Okay, just reading another question here. All right, lots of thank yous. Yeah, you're welcome. All right, I think, is that it for the questions? All right, well, I want to thank everyone for joining us tonight. May God richly bless you and your family. And if you have healing issues, think about the light. It can really help. And by the way, one final thing, since I've been doing some traveling lately, turns out that the palm light can treat people even in the airplane. We ended up sitting beside some people, and it was interesting. We got into a discussion and found out one of the people had really painful foot for years, and even in 20 minutes, their foot was much less painful. They were very pleased. But now, because our device does not have a big lithium battery on it, and lithium batteries are scary to the aviation because of the fires that you've heard about with lithium battery. There is no lithium batteries on our device. Anyways, we have it plugged in on a 120 volt power adapter, so it's low voltage. It's very safe. And the adapter now, which I was able to do, is I had a kink in my neck from trying to sleep for 2 hours on a jet plane. So I had my light in my briefcase. Now on some of these longer flights, they'll use, some of the planes now are outfitted with the 120 volt plugs. So you can plug it in and use the treatment on board. And there's nothing scary about this. Now you might, if it's in the middle of the night, you might not want to use the bright red because you'll wake everybody up. But It definitely, the near infrared does a wonderful job, and I got rid of that kink in my neck. So anyways, well, have a great week. All the best to everyone. Bye for now.